What is a normal calcitonin level? Imagine a tiny hormone that helps keep your calcium levels in check, produced by special cells in your thyroid gland. That hormone is calcitonin, and understanding its normal levels can tell us a lot about thyroid health. So, what exactly is considered a normal calcitonin level? Well, it varies slightly depending on your sex and the laboratory standards used. For men, a typical normal level is usually less than about 8.4 picograms per milliliter. For women, it is generally less than about 5.0 picograms per milliliter. Some labs might set the upper limit a bit higher, around 20 to 25 picograms per milliliter, but these are still considered within the normal range. These levels are what you'd expect when there is no abnormal activity or growth of the thyroid C cells that produce calcitonin. Calcitonin plays a minor but important role in controlling blood calcium levels by lowering calcium when it gets too high. It is produced by the parafollicular C cells in the thyroid gland, but it is not the main hormone involved in calcium regulation. That role belongs to parathyroid hormone. When doctors measure calcitonin levels, they are often looking for signs of certain thyroid conditions, especially medullary thyroid cancer and C-cell hyperplasia. If calcitonin levels are significantly higher than normal, it might suggest abnormal growth or activity of those C cells. For example, if your basal calcitonin level is above 100 picograms per milliliter, that is usually a strong indicator of medullary thyroid cancer. Levels between 10 and 100 picograms per milliliter fall into a gray zone, meaning further testing is needed to clarify the situation. It's important to remember that a normal calcitonin level does not completely rule out thyroid cancer or related conditions. Some people with these issues might have only mildly elevated or even normal levels. Conversely, elevated calcitonin can sometimes be caused by other factors like certain other cancers, kidney disease, pregnancy, smoking, or some medications. Clinical practice: doctors use calcitonin blood tests mainly to help diagnose medullary thyroid cancer or C-cell hyperplasia, especially if there is a family history or thyroid nodules. It is also useful for monitoring treatment success and checking for recurrence after surgery. Because normal ranges can vary and false positives can occur, calcitonin results are always interpreted alongside other tests such as ultrasound scans, biopsies, and genetic testing. To sum up, normal calcitonin levels are generally low, usually under about 5 to 8 picograms per milliliter for both men and women, or sometimes under 20 to 25 picograms per milliliter depending on the lab. Levels above this range can suggest increased activity of the C cells and may point to conditions like medullary thyroid cancer. Levels above 100 picograms per milliliter are especially suspicious. But remember, a normal level does not completely rule out disease, so always discuss your results with your healthcare provider who can interpret them in the context of your overall health and other tests. This way, you get a clear, accurate picture of your thyroid health based on current medical guidelines and scientific understanding.